Good morning. I'm John Eichelberger, and it's my privilege to continue the conversation we're having about the best way to deliver better care and more access for people in Pennsylvania, especially those in underserved communities. It's a discussion that's long overdue. And because of the ugliness of our present-day political debate, few in the public have heard all the facts. In 2017, many women in Pennsylvania live a reality that health care is no longer next door, no longer affordable, and far too limited in the scope of services. This isn't acceptable. There can no longer be two women's health care realities, one for the well-resourced and the other for those with no resources at all. Within a 5-minute walk from this Capitol building, the substandard care is reality for thousands of women in this city. The political debate on women's health care often centers on the availability of a single procedure, abortion, not the complex, sophisticated array of services women need for personal health and wellness. With public relations teams, hundreds of thousands of dollars in political resources, and lobbying muscle, the public is presented with political slogans disguised as health care facts. Organizations like Planned Parenthood court contacts in the media, and many in the press have repeated their PR points without doing the hard work of investigating and vetting their claims. Planned Parenthood offers so much more about abortion. They argue in their marketing campaign. It's about providing care no matter what. Sadly, journalists in Pennsylvania have done little to investigate their rather audacious claims. Respectfully, it's time to put biases and opinions on social issues aside and ask objective questions again. If you're a pro-choice journalist who believes pro-lifers are wrong, it shouldn't be a license to stop asking hard questions. Instead of copying and pasting the list of services Planned Parenthood claims to provide, shouldn't we compare brochure and website language to the actual experience of women visiting and contacting a local Planned Parenthood clinic? Instead of repeating Governor Wolf's claim that legislation prioritizing women's health care funding would jeopardize Planned Parenthood's prenatal program, shouldn't we ask if they even provide prenatal care? Instead of allowing Planned Parenthood to position itself unchallenged as the judgment-free expert on women's health, isn't it time to hear from others, perhaps those serving in federally qualified health clinics? Is anyone asking whether Planned Parenthood is really the best we can offer Pennsylvania's women? Do they provide an unrivaled standard of women's health care, one that pushes them to the front of the funding line over less politically engaged health care providers? In my district, there are no Planned Parenthood locations. They closed their last location in Carlisle, which would service some of my people, in 2013. There are, however, 9 federally qualified health centers throughout my district, including one in Carlisle. It's the same story in the community served by Representative Judy Ward and Representative Paul Schemel, who are here with me today. This morning, for those willing to consider these questions, Dan Bartkowiak with the Pennsylvania Family Council will provide an overview of key findings related to the state of women's health care providers in Pennsylvania. Dan will be followed by Representative Judy Ward, the only registered nurse in the legislature, someone who is compassionate and who shares that compassion as with her voice for their health care. We're here today because we know that we can deliver better care and more access to the people who are depending on us to do the right thing. Thank you for being here.
Good afternoon. I'm Representative Judy Ward, and I want to thank you all for being here. I'm joined here this afternoon by my colleague and co-sponsor of the House version of Senate Bill 300, Representative Paul Schemel. Last session, under Paul's leadership, we introduced this bill as House Bill 1623. This session, we will again introduce it as a companion bill to Senate Bill 300. Currently, there is limited federal and state public funding for family planning and comprehensive women's services. This legislation prioritizes the distribution of those funds to make a level playing field for all women in the Commonwealth. As funds get squeezed even tighter, it is just so important that we have our priorities straight. This legislation does just that. It puts the dollars into healthcare facilities that are close to home for women. Doesn't it just make sense that we would fund clinics and healthcare facilities that are close to the people who need the services? This bill is so important, most especially to women in rural communities. This would make a significant difference to the women in my district who might have otherwise had to travel out of our area to get these services. I thank Senator Eichelberger for his leadership in the Senate on this issue and look forward to passage of this important piece of legislation for all women in the Commonwealth. Thank you.
Hi, my name is Dan Bartkowiak with the Pennsylvania Family Council, and my comments center on the interest, as we all should have the interest, in investing in the best care and access for family planning services for women and families across the state. In 2017, March 2017, let me see here. Got these slides. Well, they don't have the slides here. Forgive me. But just in 2017, March 2017, Planned Parenthood closed their Easton location in Pennsylvania, as well as their Bristol location, marking 11 closings in the span of just a few years since 2013. On April 12th, 2017, the Neighborhood Health Centers of Lehigh Valley, federally qualified health center, announced the opening of a new location in Easton's West Ward. In the announcement, I quote, featuring comprehensive health care services, including primary care, prenatal care, women's health and family planning, mental health services, and dental care, end quote. Our elected officials here in Harrisburg have a great responsibility. They are challenged with making the most of our taxpayer dollars. And every elected official really should be asking, who provides the most comprehensive care for women in Pennsylvania? If we analyze specifically Planned Parenthood, I think we find that it's not the best option for family planning services. In looking at the last few years, 24,000, that's the drop in patients annually served by Planned Parenthood in Pennsylvania since 2013. Their basic health services are declining. It's looking at their own numbers since 2014. STD testings are down 52,000. Pap tests are down 3,000. Breast exams are down 7,000. There is not one Planned Parenthood clinic that is even authorized to perform a mammogram. There is not one Planned Parenthood in Pennsylvania that offers prenatal care. As I mentioned before, 11 clinics of Planned Parenthood have shut down voluntarily since 2013. That's 1/3 of their clinics have recently shut down. There are two items for Planned Parenthood that have increased. One would be abortions. Abortions have increased 4% in their latest reporting year. Over 17,000 abortions happen at Planned Parenthood in Pennsylvania. That's more than half of the abortions in the state. The other item is government funding. In the most recent reporting year, they have reported a 15% raise in government funding. It's close to $6 million was reported in 2015 of government funding. Now, if we compare federally qualified health centers, you'll see there's a big difference. Every basic service for federally qualified health centers in the state are increasing. There's more people going to federally qualified health centers, a 7% increase in the latest reporting year. HIV testings have increased 2%. Mammograms are up 51%. Prenatal services up 2%. Pap tests are up 13%. There are over 300 federally qualified health centers across Pennsylvania spanning 52 counties compared to Planned Parenthood's 25 facilities in just 16 counties. It's that kind of investment that we should be making in these health centers. Also, these health centers provide transportation for women and families to get to their appointments, to get to referrals. That's the kind of investment that Pennsylvania should be interested in pursuing, and that's exactly what we're looking at with Senate Bill 300.
Good morning. My name is Alison Adams, and I am the Director of Advancement at a Pregnancy Resource Center in Lancaster, Pennsylvania. Of the 25 Planned Parenthood facilities in Pennsylvania, none offer prenatal care to women in need. I know that because I called all of them to find out. I called and I received responses like, "We do not offer prenatal care at Planned Parenthood." No Planned Parenthood offers this service. This is not a service Planned Parenthood offers anywhere in Pennsylvania. So I heard firsthand that prenatal care is not something that Planned Parenthood can offer to women in need. Referrals are not the same as providing a service. Planned Parenthood says that they provide prenatal care, but what they really provide is just a referral. So that is not the same thing for women who are seeking that service. At a Women's Concern, the Pregnancy Resource Center where I work, we can confidently refer women to local federally qualified health centers, one of which is about 2 blocks from our office. And we are confident that they will receive comprehensive services for whatever their needs are. They can come to the federally qualified health center and they can receive any service that they need regardless of their income or their ability to pay. So we, again, can send our women there and know that they will receive the best care. This lack of care from Planned Parenthood just affirms their core mission of abortion and not services that support parents and parenting. Abby Johnson, who is a former Planned Parenthood clinic director, tells us that Planned Parenthood chose to phase out their prenatal care many years ago because it is not revenue generating for them. Again, this just affirms their focus as an organization. Women and families deserve better. They deserve better care and more access.
Good afternoon. My name is Sue Swayze Liebel, and I am here from the Charlotte Lozier Institute in Washington, D.C. It was founded in 2011. Dr. Charlotte Lozier was an early feminist, a contemporary of Susan B. Anthony, and she devoted her career to medicine, science, research to the cause of life. Our organization brings together physicians, sociologists, statisticians, policy researchers to bring the power of science and medicine and research to bear on life-related issues and media debates and times like we're doing here. I wanted to point out to you today that we have done a lot of research on federally qualified health centers, rural health centers, look-alike centers, how many options there are around the country. I think someone just mentioned for federally qualified healthcare centers, transportation is part of the service. Transportation is an expected part of the service. Rural health clinics are also federally funded, but they're designated as non-urban and in underserved communities, rural communities that currently have healthcare shortages. And Pennsylvania has one of the largest rural populations in the country, as the senator said before. The lookalikes are the same type of thing. They are approved by the federal government. They don't necessarily receive the funding yet, but they're still operating. Nationwide, the ratio of at least these 3 types of clinics that are available in Pennsylvania to the 25 Planned Parenthoods is nationwide, the ratio is 23-1. Here in Pennsylvania, you have 284 of these types of clinics, 201 of the FQHCs, 71 of the rural healthcare clinics are here in Pennsylvania, 12 additional lookalikes, that's 284 clinics to the 25 Planned Parenthood clinics that are here in this state. That's a 9-to-1 ratio, and my understanding is, and our research shows that the average distance to the nearest health center is 5.6 miles. Now that's an average, but it shows that they're community-based, which is what they are, is federally qualified community health centers. The community health centers here in Pennsylvania have outperformed Planned Parenthoods in your state 3 times the number of PAP pap smear tests, cancer screenings. 100% more mammograms are done by the clinics because, of course, Planned Parenthood doesn't do mammograms. 7 times more patients overall are served by these sorts of rural and federally qualified healthcare centers in your state. And that's good news. That's good news because they're providing not just family planning services, but also a wider array, a broader access. If she's taking her children with her, they may have a stuffy nose, there may be an x-ray needed, there's a lot more care there. It's a wider breadth of breach of care for women and their families with transportation available. So we think that's a much better deal for women than a kind of a standalone family planning clinic with just a few services. Also, I wanted to close with some more research. We conducted a poll with 6 states. This was done in January of 2017, just this year. 6 of the kind of battleground states for the 2018 Senate race was our target: Florida, Missouri, Montana, North Dakota, Ohio, and Wisconsin. Not Pennsylvania, but a swath through our country. And a majority of Americans don't want their tax dollars to go to entities that provide abortion. They want to support women's health care, they want to support a wider access, but they want that to be abortion-free. 56% don't want their tax dollars being used for this, but would be very supportive of women's care. So thank you for having me today. Appreciate the opportunity to speak in favor of the bill.
Well, thank you to everyone for listening. Thank you to Senator Eichelberger, Representative Ward, Representative Schemel. And that concludes our conference here. You can find more information about some of the legislation, bettercaremoreaccess.com. And again, that concludes our time. So thank you very much for listening.